Hi, I'm Dr. Mike Jones, Hospital Director at Woodland West Animal Hospital. Today we're going to walk you through an ovariohysterectomy, or spaying, which refers to the surgical removal of both ovaries and the uterus from your pet. Spaying is a common abdominal procedure in the veterinary hospital. This procedure typically takes about an hour from start to finish. Every patient brought to Woodland West Animal Hospital undergoes a pre-anesthetic evaluation with a doctor, as well as pre-anesthetic blood work to check for any underlying infection, clotting disorder, or organ dysfunction. Your pet is given an injection of an opioid pain medication, as well as a sedating, tranquilizing medication. These medications will work to relax your pet and make sure the procedure and recovery are pain-free. Once your pet is pre-medicated, she is prepped and induced for surgery. The area of the arm is clipped, cleaned, and a sterile IV catheter is put into place. After the catheter is placed, medications administered through the IV catheter will ensure the procedure goes smoothly. These medications are called induction agents, and they help her to fall asleep. Once asleep, a breathing tube is placed into the trachea. She is placed on inhalant anesthesia and oxygen. The surgical site is clipped of hair and cleaned with an antibacterial scrub. Your pet is taken into a surgical suite where she is placed on a heated table and is secured to the table to ensure stability and safety. She is connected to multiple surgical monitors, an ECG monitor to measure her heart rate, pulse oximetry to measure oxygenation, a blood pressure cuff, and IV fluids are started. The technician performs a final scrub of the surgical site as the doctor scrubs and prepares for surgery. The doctor is completely sterile, as well as the instruments, drape, and suture that is used on your pet. It is essential that all these stay sterile so that the open abdomen is not introduced to any contamination. Surgery begins as the doctor uses a scalpel or laser to make an incision into the abdomen. Both ovaries and the Y-shaped uterus are located. Ligatures are placed on both ovaries and the uterus, and then the full tract is removed from the body. The abdomen is checked for any excessive bleeding before being closed with 3 layers of absorbable suture. While the patient remains on oxygen, the anesthetic gas is discontinued and the patient is disconnected from the monitoring equipment. The oxygen is discontinued as the patient is taken into recovery, which is lined with blankets and heating to keep the pet warm. She is kept warm while awakened from the anesthesia by the technician. Once she is able to swallow on her own, the breathing tube is removed from her trachea. She is kept in a quiet, warm area and monitored closely while she recovers. Before leaving the hospital, the IV catheter will be removed and a prescription of pain medication will be prescribed to be sent home. Once home, 72 hours of confinement with no running or jumping, your pet is free to resume normal activity. The sutures are all absorbable, thus there is no need to return for removal.